COVID-19 hospitalizations have finally gone down here in Central Texas counties, but in the last 2 months, hundreds of people have died because of the pandemic.
But is there a lesson that we can learn to keep this from happening again? 6 News reporter Andrew Moore went over the numbers and spoke to the McLennan County Health District today. He joins us now in studio to discuss. Andrew?
While the Delta variant was the worst yet, it's now clear Central Texas could have responded better, and there are steps that we can all take to keep this from happening again.
There are many lessons to be learned. The first is that we really can't let our guard down.
In June, it looked like the worst of COVID-19 was behind Central Texas. Instead, the next few months would set records when it came to COVID deaths. In McLennan County, the number of fatalities suddenly jumped from 10 in July to 71 in August, and then a record-setting 107 in September. There are 11 in October so far. In Bell County, according to DSHS and CDC numbers, the numbers jumped to 117 in August, when the CDC says the county's death rate was at the highest. They dropped to 53 in September. McLennan County Public Health District spokeswoman Kelly Crane says the Delta variant was bad, but the lack of masking and distancing was just as significant.
We were all lax in our mitigation efforts. Vaccinations had slowed down, and this was the perfect time for Delta to come in and just explode.
But there is a lesson behind that explosion. When you look at the COVID-19 spike in cases in McLennan County, the 2020 spikes were bad, but Texans were masking and distancing. Then Texans stopped. Only half of residents got the vaccine, and the Delta spike was nearly twice as high. Crane says it didn't have to be.
COVID-19 is a preventable disease now.
And while there will be another variant, Texans can choose to respond to it differently with masking, if nothing else. Crane says this doesn't have to happen again.
Vaccination, wearing masks, we have to get vaccinated. Those are the biggest lessons.
Crane hopes that fatalities will also decline, but we don't actually know if that's going to happen as of yet. We just keep watching those numbers, guys.
All right, Andrew Moore live in studio. Thank you. Now.